have people with clonal hematopoiesis and higher risk of cardiovascular events?
I've learned from my colleagues in hematology oncology that as we age, we accumulate somatic mutations that start in our bone marrow stem cells that lead to proliferation of specific populations of leukocytes in the peripheral blood that have mutations, and this increases total mortality.
We accumulate somatic mutations in blood with age. Is clonal hematopoiesis causal in atherosclerotic cardiovascular disease?
What we've learned is that you cannot account for the increase in mortality in the people who accumulate these clones of abnormal white cells due to hematologic malignancy. There's a big gap between the mortality and those who die of the hematologic malignancies. So we need to explain that gap. And so recently in the New England Journal of Medicine, we reported that there is an increase in cardiovascular events in these patients who have these abnormal clones. And so that raises the question of whether we accumulate these clones with aging, and we also accumulate risk of cardiovascular disease with aging, and they're true and unrelated, or if there's causality of these mutations and cardiovascular disease.
Now, what is the role of TET2 mutations?
Well, there are about 4 different mutations which tend to resurface in these people with clones, as shown by deep sequencing of the exomes of their DNA. And one of these mutations, which is called TET2, has been studied experimentally in the laboratory of Dr. Kenneth Walsh and by our group at the Brigham and Women's Hospital, as reported in a recent New England Journal paper that was first authored by Siddhartha Jaiswal and which was senior authored by Dr. Ebert. And in collaboration with our experimental laboratory, both the Walsh lab and our lab were able to show that atherosclerosis in mice is increased when they harbor loss-of-function mutations in TET2. So we were able to start with the patients, identify a specific mutation which led to clonal hematopoiesis, and we believe that we can close this gap, understanding the mortality signal in these patients, because our experimental work, inspired by patient observations, suggests that these mutations may be causal in atherothrombosis. So we're just at the very beginning of what I think is an exciting new chapter in atherothrombotic risk.